Wel, diolch yn fawr I chi am y cyfle I ddod I siarad gyda chi heddiw, fod yn rhan o'r sgwrs positif yma ynglyn â gofal sy'n seiliedig ar berthynas. Thanks very much for the opportunity to come and speak to you today and be a part of this really important conversation on relationship-based care and talking about relationship-based care. Some of you will be aware I'm married to a GP, and I can assure you that our pillow talk has changed quite a lot since I became health secretary. Poor little love, he's just nodding off to bed and I'm saying, what's vascular? I've moved on since then. So it is really important, I think, for us to understand the pressure that GPs are under at the moment. And I can tell you, living with a GP, I'm more than aware of that. And I'd just like you to be assured that we are not insensitive to the kind of work that you're having to undertake at the moment. As Rowena has described, the benefits of a strong and trusting relationship between a doctor and their patients are indisputable. Where a patient feels safe and supported, they're going to feel confident to have a greater voice, I think, in decisions about treatment and ongoing care. And the care that results is likely to be based on a more holistic understanding of their particular needs and circumstances. And the continuity of this relationship, I think, provides opportunities to prevent illness or to see further ill health. And that patient-centered approach, which empowers people to engage positively with their own health and well-being, is one which I want to secure for everyone in Wales. So improving that relationship between clinicians and patients is an important part of that jigsaw piece and a whole system picture. And, you know, that's what we've got to keep on remembering, isn't it? Is that GPs are part of that huge system that is all under pressure at the moment. We know that if we fix one part, it'll pop out in another part. So we have got to keep an eye on that whole system approach. And we know also that what everybody is dealing with at the moment is a massive increase in demand. It's truly unbelievable what is happening. And however, you know, we'd planned to deal with the health service in the future, I think any of us could have prepared or planned for the kind of demands that we're seeing on our services today. And obviously, that means that we've got to adapt, and the public has to adapt, and we have to have some serious conversations in terms of the public's responsibility here as well, I think, to take charge, more personal responsibility for their own health. And for some people with chronic conditions or complex needs, seeing a doctor with an in-depth understanding of their medical history will be a far more satisfying experience, and they may want to wait to see that particular preferred clinician. But we all know that others will prioritise speed of access over seeing the same doctor consistently. So they'll want to take advantage of new and more convenient ways of accessing services through online inquiries or telephone consultations. And you've heard me be very clear on this. You know, we had to move online very quickly during the pandemic. And, you know, some of that was really, really positive, and we're locking it in. And you didn't see me saying what they were saying in England, which is get back to face-to-face consultations. You know, that was not going to happen here, because actually there's lots of really positive things that have come out of that. Understanding and meeting the many and varied needs of the people in Wales today is a huge challenge for modern general practice. How we offer a high-quality consultation to an older person who has visited the surgery 3 times in the last 2 months with different systems. How do we do that? All of those things are having an impact on their mobility and their quality of life. How do we make sure that the mother of a child with repeated ear infections can get through to the practice quickly and access the medication that they may need? So people regularly share with me their frustrations at not being able to contact their GP. I can tell you that my email box is constantly full. But if people are to benefit from relationship-based care within the surgery, we do need to make it easier to get an appointment in the first place. And I'll continue to press for access improvements to ensure we're offering a service that is broad enough to encompass both that ease of access and that continuity of care. And this balanced offering, which can deliver the best outcomes for patients, is at the core of our ambitions for primary care and contract reform in Wales. Our access commitment, introduced in April this year, aims to strike this balance. It introduces steps to make the process of obtaining a consultation as efficient and as streamlined as possible, providing a smoother experience for the patient calling the practice. And we're currently testing out, for example, the new app that we'll be introducing soon. And, that's an example of where, where it's appropriate, can we make things easier for you? Can we get repeat prescriptions done online? Can we use the app? But we need you to engage with us to make that happen. And, what we're not doing is what they did in England, which is they switched on the app with fanfare and everybody was very excited. And actually what happened is all the GPs just switched it all off because they weren't ready for it and the process wasn't in place. And we're trying not to make that mistake here in Wales. So we're working with people, testing out the pilot at the moment, just making sure that the system is robust and that you're coming with us on that journey. It's really important. You have to be there with us on that journey or it's not going to work. So I think increasing speed of access shouldn't mean compromising on high quality care. The access commitment calls for efficient processes for patients and staff to create more time for in-depth consultations with the people who really need them. And within this commitment, we've required practices to make provision for pre-bookable appointments so that those patients who prefer to wait can see the doctor of their choice. Meeting the commitment also includes collecting and learning from patient feedback on their experiences, providing us with a much richer understanding of what access needs people have and how services can change and improve in response. And I want to see all practices making the most of this opportunity to engage with patients on their lists and to use that access commitment as a national framework to support the development of relationships and that continuity of care. A key aim within our programme of contract reform has been to reduce the administrative burden on GPs, freeing them up to do what only they can do and to spend more time in consultations with patients. And some of this is through digitisation and e-prescribing. So if we can join our systems together, if we can share our data in an easier way, this will free up more clinician time to see and help patients. So I spend a huge amount of my time just driving the digital agenda within the NHS because it feels pretty prehistoric to me. We've got to move on and embrace the 21st century. We all spend our lives on our mobile phones and we're still using paper in the NHS. It's time to move on. So that is coming. We're spending a huge amount of time. We want to get it right. And so, again, we're trying to make sure that we work with you on that. But for this approach to work in a system where demand shows little sign of abating, GPs need to be able to draw on the support of a multi-professional practice team, where routine chronic condition management can be undertaken by nurses, by pharmacists and others working within the practice. And these contacts, I think, present opportunities to deliver that relationship-based care too. It's not all about GPs, this relationship-based care. It's got to be broader than that. And I think it's really important that practices can communicate well among staff and take a patient-centred approach, because effective and compassionate continuity of episodes of care can be delivered by that whole team, not just the GP. And I was really pleased to see the strengths of the multi-professional approach recognised in the RCGP report and highlighted again by Rowena. A model that offers continuity of care, making the best results and the use of professionals we have, and which meets the range of needs of people across Wales is a big ask. But I hope that this discussion today around how we can make relationship-based care work in modern general practice will continue to flourish. And while we can't keep looking back to an outdated idea of the family doctor that no longer fits in with the realities of working in Wales today, we can ensure that we retain the principles and the ethos of relationship-based care. I'm really excited about the Deep End project, something else that I think you've been driving, very excited to see that coming to fruition. And I want to encourage you as GPs with your teams to continue to innovate and to bed those relationship-based models of service delivery in your practices. I can promise that we will elevate this good practice with GP collaboratives and clusters so that we can draw out the positive benefits of relationship-based care, both for clinicians and for patients. Diolch yn fawr iawn i chi gyd. Thank you.